próximo speaker es el doctor Bernardo Cortese. Ay, Bernardo. El doctor Cortese es probablemente una de las personas que más experiencia tiene en Europa con los balones con droga, y él nos va a hablar de un balón que tenemos poca experiencia con él, que es el balón de Sirolimus. Estamos muy acostumbrados al Paclitaxel, pero este es distinto, el Sirolimus, y es el balón Magic Touch. Bernardo.
Okay, thank you, Tony, for the presentation. I beg your pardon, I cannot speak Spanish, I just may understand, but I need to deliver this speech in English. We know from the past that paclitaxel-coated balloon in native vessels have a very good outcome. In this study, this is the 3-year outcome of the bellow study. They outperformed the Taxus stent in terms of MACE. We have a lot of drug-coated balloons. I'm pretty sure that I've not put all of the drug-coated balloons that we have now in this slide, but they are a lot, and a lot of them do not have a reliable clinical program. So this is the first point. The second point is that there is a very large difference between the different paclitaxel-coated balloon in terms of efficacy and in terms also of late loss. And it's quite different if compared to drug-eluting stents, the ones that we are using now in our cath lab. So we don't have a class effect with this category of devices. Other limitations are that they often have a cumbersome delivery system that may impair the drug delivery at the lesion site. And the other point is that paclitaxel has a limited therapeutic window. That's, I don't think, an issue for coronaries, but it could be for peripheral applications. So the players are, as I said, paclitaxel, that is a cytostatic drug with very high lipophilia that render it the first drug to be used with this technology since the very beginning, in the very first years, 2000. It has a very high tissue penetration, but as I said, the therapeutic window is not so high. And then we have the Sirolimus or other components of this family. It is a cytostatic drug with a much lower lipophilia, but a more potent smooth muscle cell inhibition property. We know that any drug that we want to deliver to the vessel wall will have to follow this law, that is the fixed law of diffusion. That means that the absorption rate is determined by the vessel surface, the drug concentration, and drug permeability. So if we want to have a drug-coated balloon with other drugs different from paclitaxel, we need to work on drug permeability. And that's what happened for the Magic Touch, where Sirolimus was encapsulated in a protective pack thanks to nanotechnologies. And this protective pack had the aim of protecting Sirolimus and helps it to be delivered to the vessel wall. That could be possible thanks to this phospholipid bilayer that increased the lipophilia of these nanocapsules. What has been shown previously in animal models is that the behavior of Sirolimus with this technology was quite similar to paclitaxel. That is, that it entered the vessel wall up to the adventitia and the external elastic lamina. We have a very limited data with this device that obtained the CE mark just last year. But we were able to publish the first data, the first consecutive patients in this small registry at our center. They were quite difficult angioplasties because 50% of the cases had instant restenosis and 1/3 of the cases overall had failure of paclitaxel-coated balloon, 31%. What we obtained was, these were the characteristics, but for time's sake, I don't want to go on it. We had a pretty good clinical outcome after 6 months with only 3 cases of target lesion revascularization in this complex setting. Obviously, that's not enough, so we wanted to check the effect of this device also for native vessels, and that's the reason why we analyzed our first consecutive patients treated with this device. There were 21 with a 6-month angiographic follow-up. Reference vessel diameter was small, 2.5, final stenosis 14%. And what we found at the angiographic follow-up was that we had a late lumen loss of 0.12 plus or less 0.3. This is not a control study, but is some proof of concept, very preliminary data that seem interesting with this new technology. We are also running the Eastman registry. It's an all-comer registry, a prospective registry that will enroll 1,000 patients at 30 European and Asian sites with a follow-up, a clinical follow-up of 2 years, and we will enroll any type of coronary lesions that will be treated with Magic Touch Sirolimus coated balloon. The primary endpoint of the study will be target lesion revascularization, and secondary endpoints will be angiographic success, procedural success, MACE, and any determinants of the MACE. We will be also running a randomized clinical trial versus the best-in-class, that is the Zion stent in small vessels. This study will be enrolling patients in the next 2 or 3 months, and we will see if we'll have a similar outcome with Sirolimus, with a everolimus eluting stent in small vessels, up to 2.75 millimeters with lesion length less than 30 millimeters. So my conclusions are that Sirolimus coated balloon might constitute a new therapeutic options in the setting of complex coronary lesions like the ones that we are facing now in our cath labs, also considering the good deliverability of this device and the good trackability. Obviously, this strategy will not go against the first-in-class drug-eluting stents that we are using, but it will be a synergistic option to be used with a DES. But we need ad hoc powered studies that will tell us if this technology will have a role in our cath labs. Thank you.
Thank you, Bernardo.